All right, good morning, everybody. My name is Rich Madalino. I'm the Chief Administrative Officer of the Montgomery County Government. Our County Executive, Mark Elrich, is out of the country on a trade mission right now, so he's unfortunately unable to join us. But he wanted to make sure for me to thank Congressman Raskin for his work each and every day for the people of Montgomery County, not just today, but especially today, to come in and highlight the work of our Montgomery County Department of Health and Human Services, our efforts to make sure people are fully insured and have health care and access to health care in the state of Maryland, and your work every day fighting to end the government shutdown and get us back into a situation where people can come in and apply for health insurance. So Congressman Raskin, thank you very much. You are all in an office of the Montgomery County Department of Health and Human Services, and there is no government agency in the state of Maryland like the Montgomery County Department of Health and Human Services. Decades ago, Montgomery County made the decision to take over authority of our health and human services programs so that we would have more control over what exactly services we provide to whom in Montgomery County. Thanks to the goodness and support of Montgomery County residents, Montgomery County taxpayers, multiple generations of elected officials, we have developed a system that provides access to care to just about every person in Montgomery County so that we make sure no one falls through the cracks, because having healthy residents is key to a strong economy, is key to happy families, is key to children getting a good education. We're proud of being the healthiest county in Maryland. I'm joined today with other people from Montgomery County. The Assistant Chief Administrative Officer, Dr. Earl Stoddard, our Health Officer, Dr. Keisha Davis, our Division Chief for Public Health Services, Dr. Nina Ashford, Mr. Sean Gibson. We employ people who don't have doctors. So just in case people are interested, you don't have to be a doctor to work for the Department of Health and Human Services, but Sean Gibson, who's our insurance manager, and there are many other county officials who are here. Dr. Oscar Mensa, who is our social services officer. There are other HHS employees in the room who I'm sure may be introduced as time goes on. But again, thank you very much, Congressman Raskin, for your work, for your dedication to these issues as a citizen, resident of the county, as a state senator, as our congressman. You have been at the forefront of trying to make sure every person in your district, in our county, state, in our country has access to affordable health care. And it's just despicable, in my humble opinion, as not an official position of Montgomery County government, but that we are in a situation where one of our major political parties, the one you're not a member of, is out there today working very hard to make sure people in our community and in our country no longer have access to healthcare, or at least affordable healthcare. So we're thrilled to host you. We're thrilled to tell you about the great things we're doing and to help you tell the people of your district, of our community, what you're fighting for and why these actions are so critically important for the future of our community, whether it's families, whether it's businesses. It's critical that we have health insurance and a healthy community. So thank you, Congressman Raskin.
Well, thank you, Senator Madalino. I'm experiencing a little bit of a flashback here because Madalino and I used to sit next to each other on the floor of the Maryland State Senate for 10 years between 2006 and 2016, roughly. And he was an incredible senator, and he's an amazing chief administrative officer. And you're a damn good acting county executive today, too, with with Mark Elrich over in China. So thank you for everything that you do and for assembling this remarkable group of people who invest their lives in the healthcare and the well-being of Montgomery County. And it shows Montgomery County is ranked #1 among the counties just year after year because of the structural investments we've made in healthcare and because of the remarkable people who spend their time delivering healthcare to our people and making sure that everybody's covered. And as we're involved in this big fight in Washington about whether or not we're going to be throwing millions and millions of people off of their health insurance, this is a nationwide crisis that includes Maryland, but it's an absolute emergency for those states that don't have the state and county structures that have been put in place that we're using to try to absorb the shock of these coming devastating cuts. So let me just, I want to thank everybody, and then I want to say a few words about the general nationwide picture, and then we've assembled this remarkable cast of characters to be able to talk to us about what's happening, and I want to get to them. Thank you, Brian McCoy, the Montgomery County Property Manager. Thanks to Sean Gibson, who's the Health Insurance Manager. Thank you to Mary Anderson and her team, Scott Peterson and Peter Sinclair from the Montgomery County Communications Office. I want to thank everybody from the Health and Human Services staff who've shown us around and who provide such excellent first-class healthcare to all of our constituents. And thank you to Michelle Eberly, who's the Executive Director of the State Health Benefit Exchange in Baltimore, who's joined us today and is doing such a great job trying to get ready for everything that is happening. Look, it's day 22 of the Republican government shutdown. Our Republican colleagues have not been coming to work in Washington. President Trump said he didn't want the furloughed federal workers, or at least some of them, to get paid. He didn't want some of the people who are working without paychecks to get pay when it's all over. We passed a statute to guarantee people would be paid, but somehow he's threatening not to pay people. If anybody shouldn't get paid, it is Speaker Mike Johnson and the Republican members of Congress who not only shut the government down, they've shut Congress down. They haven't shown up to work where we need to be negotiating an end to this crisis. They're not having town hall meetings in their districts because they refuse to face their constituents. So we are urging Speaker Johnson and the Republicans to come back to Washington so we can end this impending calamity for the health security of our population. There are millions of people across the country who are facing losing their health insurance because of the cutoff in the Affordable Care Act tax credits. The premiums for people's monthly health insurance payments are going to have to be paid completely by our people instead of having the benefit of the subsidy coming through the Affordable Care Act. And there are lots of people out there who've been getting that benefit and don't even understand it's been coming through the ACA, through Obamacare. They think it's just coming from their state, but they're in for a rude awakening when they realize that no, their state is not going to step up and help them out. But in Maryland, we do have a state government that is committed to trying to help as many people as possible get through this crisis. But the reason why we're getting support from across the political spectrum now, like from Marjorie Taylor Greene in Georgia, is because all over America, people are coming to recognize that millions of people are not going to be able to afford participating anymore in the ACA, which means they will drop out of the program. They will not be covered by health insurance. And as uninsured people, they're going to be less healthy. They're going to grow sicker. And they're going to end up in the emergency rooms, overrunning the hospitals, and again, driving everybody's rates up. And this is why we're telling our colleagues, come back and negotiate continuation of the ACA tax credits and undo the damage that's been visited on our healthcare system by their big, wretched, monstrous bill, which cut nearly $1 trillion out of Medicaid and Medicare at the same time that they offered a $1 trillion tax break. So what we have is the largest cut in Medicaid in American history at the same time that we have the largest tax break for billionaires in American history. So that's a very ugly statement that's being made, and it's also one that's dangerous for our people. So I want to talk very specifically about what all of this means in Maryland, what the state government is doing, what the county government is doing to prepare to absorb the shock of these events and to cover our people, because we're in Montgomery County almost in a unique posture with respect to being ready to deal with something like this. It's still going to be horrific, but we're in much better shape than people in Georgia or Montana or Florida are. And you know, the political pitch I'll make to my colleagues is when you look at who is going to be suffering the most across the country, it's people in red states, because their state and county governments are not prepared for this and have not stepped up to pick up the slack. We have, you know, disproportionate numbers of people in the red states that have been depending on the ACA tax credits and on Medicaid coverage. So it's obviously very important to our people too, but we say to our colleagues, look at what this is going to do to your own constituents, and that's why we're demanding they all come back to Washington. All right, so with that, I get to introduce Dr. Ashford, who is the Montgomery County Chief of Public Health Services. She's got 15 years of leadership experience in public health programming, not just at the local level, but at the federal level and the state level as well. And she was a full-time faculty member at the Tufts Medical School. Is that right?
Yep.
The Tufts School of Medicine, where she's been a leading scholarly light on public health. And she now guides our efforts in Montgomery County on operations, strategic planning, and health equity. So thank you for joining us, and thank you for coming to explain what all of this means for MoCo specifically.
Yeah, absolutely. Well, first, thank you, Congressman Raskin, for convening this roundtable today and drawing attention to this really important issue. Medicaid is an integral part of the healthcare delivery system within Montgomery County. And when we talk about the Medicaid impacts from HR 1, it's really important to be clear about which populations are going to be impacted. These cuts will not impact the elderly, and they will not impact the disabled populations. When we talk about, specifically, when we talk about the impacts from HR 1, we are talking about the Medicaid expansion population. So these are individuals 18 years old to 64 years old, along with refugees, asylees, and humanitarian parolees. And when we look in Montgomery County specifically, who makes up this population, these are our self-employed business owners, including our farmers up in the agricultural reserve. It's our workforce that works for our small businesses, which are the backbone of our economy here in Montgomery County. It's our students who are our future, our workforce. This is just an example of some of the folks who are going to be impacted. In Montgomery County, we estimate that this population makes up about 44,000 individuals. We are estimating that about half of those will lose their Medicaid coverage because of the administrative red tape from the work requirements. We estimate that about another 3,000 will lose their Medicaid coverage altogether because they no longer meet eligibility due to those 20-hour a week work requirements. We won't know the full impact of the Medicaid cuts until the state finalizes their policies in terms of how are they going to come into compliance with HR 1, but we are really mobilizing as a county and as a community to try and buffer those impacts as much as possible. We know that when individuals lose access to health care, they will delay seeking care, often until their health issues become dangerous and acute, and then they'll go to the only place they have access, which is often the emergency room. And that is just going to further exacerbate the emergency room wait times that are already a problem that we are trying to work through here in Maryland, and raise the cost of care for all of us. They also have devastating impacts on not just the individual, but our entire healthcare delivery system. As I said, Medicaid is an integral part of our healthcare delivery system. So our hospitals, our federally qualified health centers, our providers across the county will feel the impact of the decreased Medicaid revenues associated with these cuts. Thankfully, we live in a county that believes healthcare is a human right. For almost 20 years, Montgomery County has made certain that our uninsured residents have access to basic primary care through our Montgomery Cares and our Care for Kids program. We are grateful for the leadership of our county executive, Mark Elrich, our Chief Administrative Officer, Rich Madalino, and the unwavering commitment of our county council for their continued support of our safety net. We could not do this work without them. Montgomery County has always led with compassion and common sense. As a community, we recognize that when our neighbors can see a doctor and stay healthy, the whole community benefits. As we face HR 1 impacts, our commitment remains unchanged to protect access to care and preserve dignity for our residents and ensure that none of our residents are left behind simply because of where you work or how much you make. Thank you.
And thank you. And just to be clear, the HR one is the big, beautiful, ugly, wretched bill,
Yeah.
depending on your perspective.
I struggle with beautiful, so.
There we
thank you.
go. Terrific. Well, thank you very much for those great opening remarks. Now we're going to go to Dr. Peralta. She's devoted her career to reducing health disparities among youth and underserved communities through clinical care, research, and advocacy. She co-founded the Casa Rubin Foundation and previously served as the chief of the Division of Adolescent and Young Adult Medicine and director of the Adolescent HIV program at the University of Maryland School of Medicine. And thank you for joining us, Dr. Peralta.
Thank you so much. So, as you heard, I have dedicated my career to serving the most vulnerable populations. And I think I earned this honor today to be able to speak for my patients and my colleagues. And of course, to all the clinics like ours who are taking care of them. So the potential consequences of the Medicaid cuts, and as you call it, the ugly bill, are simply devastating. Cannot put any other word like devastating. They're critical and catastrophic effects in our patients. And let me introduce you to one of my patients, Mary, so you understand what the meaning of this is all about. Mary, a hardworking 38-year-old mother of 3 children. She had recurrent swelling in her neck just above the clavicle, and she didn't have coverage. She lost coverage after her pregnancies. She lost her job during the pandemic, then engaged in working again, but no longer could afford coverage. So pharmacists recommended our clinic, but it was too late. Mary had a very aggressive form of breast cancer. 38 years of age. No one is immune. That was already invasive, and tragically, it was too late to save her life. And this is the real cases. This is what it means to have gaps in cares. This could have been recognized in a primary care center, in a community center, and we failed to do that. So have we forgotten the numerous studies that we just heard about the meaning of gap of care? What are the consequences? The studies are very clear. Reducing healthcare access leads to poorer health outcomes. Increased volume of people with more acuity and severity of their conditions who are arriving to our clinics, and expect that is going to happen. And increased financial instability and unhoused situations in many cases where they have to pay from their own pocket to be able to have treatments, and with that, they lose their homes. So we heard a little bit about what is happening, and in case that the Affordable Care Act, but one thing in particular, and you mentioned that, Representative Raskin, it is crucial to recognize that these requirements that are being imposed for the Affordable Care Act now, that are related to eligibility, employment, and many other things that people now have to be recurrently doing that job, in addition to being ill, that intricate kind of system, what we are entering, is really going to yield higher volume of uninsured individuals who cannot afford otherwise to go to any doctor. So the implementations from these changes is imminent. This past August 25th, just recently, the Centers for Medicaid and Medicare and the health coverage for recipients of DACA, the Deferred Action for Childhood Arrivals. What do I say about what would happen also to people who migrated to this country and have even followed the law? Those who are or have temporary protective status, those who were granted asylum, and those with refugee status. What is going to happen to them also? Think about the impact of in the disability community, and also on those individuals who are unhoused. Think about it. In this context, I would like to focus on community clinics. Cuts in reimbursement rates, the inflation, increase in the volume of uncompensated care, and the complexity and acuity of the patients that we are going to receive will inevitably lead to a reduction in services. Or the worst, closing the clinics. We all remember the pandemic. It happened. We had to close clinics, and many of us inherited patients we never knew. We had no medical history. They were very sick, and we had to struggle to be able to find treatments. And lastly, I want to address the impact on healthcare workers. See, elephant in the room. Navigating budget cuts, all these requirements that are coming new, and the inability to provide adequate care for our patients is a true burden. And it's what causes that people leave their practices, that people no longer do medicine, even if they want to save lives. It poses serious risk to our patients. My patients may lose access to the highly skilled doctors, nurses, staff, or subspecialties that are no longer going to take those cuts that other clinics may go by and try to do whatever they can to treat the patients. But those we are in the community to provide the best possible care and potentially save their lives. This is the case of Mary. This is the woman who I introduced with you, vibrant young woman with 3 children who lost her life because of gap care. With that, I yield to you.
Dr. Peralta, thank you for your very moving remarks. And I take it that Mary is reflective of millions of people across the country.
Absolutely.
Who are in that vulnerable situation. And, you know, at a time when my MAGA colleagues talk constantly about deregulation and reducing paperwork, the changes in Medicaid are imposing a form of bureaucratic extremism and fanaticism on doctors on nurses, on personnel, and on patients that will drive countless numbers of people out of the system. Thank you for what you do. I want to introduce now Vinnie DeMarco. Vinnie is, of course, a famous public health advocate in our state who's done everything to improve public health through anti-smoking legislation, to an alcohol tax increase, to directly expanding health insurance coverage for people under Medicaid. And he's been recognized for his leadership and advocacy for public health all over the state. So please welcome Vinnie DeMarco.
Thank you, Congressman Raskin. I'm a very big fan of Congressman Raskin and Rich Madaleno. Both of them, as Congressman Raskin said, served in the state Senate, and I loved working with them. And I was sad to see them go, but I'm thrilled they're doing so much at their higher levels. And Congressman, thank you for what you are doing to protect the Affordable Care Act and to make sure that these tax credits continue so people can get their health care. Under the Affordable Care Act and the Inflation Reduction Act, Maryland has reduced our uninsured rate from 13% to 6%. Shout out goes to Michelle Everly, the head of our exchange, who's implemented so well. This has been a tremendous success. Over 400,000 people all across our state have health care now who did not have health care before we started implementing those two laws. And as you've heard and will hear, that has significant impact on individuals' lives. Lives are saved, lives are better in health and in wealth, and people being able to afford a house or other things they couldn't afford when their health cost was so high. But I want to emphasize that this drop from 13% to 6% uninsured in Maryland helped all of us. Our wonderful former Speaker of the Maryland House, Mike Bush, used to say that when people are uninsured, it causes a hidden healthcare tax on all of us. A hidden healthcare tax, because when you don't have health insurance and you go to the hospital and can't afford it, it gets covered as uncompensated care, which goes right into all of our health insurance premiums. And we commissioned a study a couple years ago, which I have here from Steve Ports, a top economist, health economist in Maryland, which shows that reducing the uninsured rate from 13% to 6% reduced uncompensated care in Maryland by over $460 million. Over $460 million that would have gone right into all of our premiums, making a higher hidden healthcare tax. If we go backwards, Congressman, I hope you will make sure everybody in the House and Senate knows this, as you know so well. If we go backwards, not only are the uninsured hurt, but all of us will be hurt. The hidden healthcare tax will go up. And under the Inflation Reduction Act's tax credits, over 24 million Americans get these tax credits, which help them help them have their health insurance coverage. And estimates are that if the tax credits don't get continued after the end of this year, 4 or 5 million of them around the country will lose their health care. That's millions of less people on health care, higher uncompensated care, higher hidden health care tax. In Maryland, 190,000 people would use these tax credits. And if Maryland didn't do anything on its own, over 110,000 of them could lose their coverage. That would be devastating for our state. We have to stop this from happening. Luckily, we have a wonderful health benefit exchange here that has been working hard to come up with a backup plan in case this disaster happens and they don't extend the federal tax credits. We have a plan that will help many of these folks continue to get healthcare coverage. The amount of premium increase for everybody on the exchange will go up by 95% without a backup plan. With the backup plan, it's 35% on average. That's still high, but it's dramatically less thanks to what our exchange is doing. And we still are afraid that maybe 50,000 people may lose their coverage, but that's a lot less than 110,000. Congressman, we need Congress to continue these tax credits for all of us in Maryland, but I'm happy to say that we have a backup plan here. We have other guardrails, let's say, in Maryland that I want to emphasize
Yeah.
to protect us from not only these tax credits, from the big bad bill also. One of them is the 2019 First in the Nation Easy Enrollment Program. At tax time, every Marylander is asked, are you uninsured? And if you answer yes, the exchange does a wonderful job of helping you if you want to get health insurance. And over the last few years, tens of thousands of Marylanders have gotten health care that way. This will be even more important as the big bad bill puts impediments in the way of people getting health care, requiring people to renew Medicaid every 6 months rather than a year, reducing the time for open enrollment. We have easy enrollment, and we're going to emphasize that in January to the public. In addition, Maryland's the first state in the nation, thanks to Delegate Laura Charkoudian, and I want to thank Chair Jocelyn Pena-Melnick for the easy enrollment and Senator Brian Feldman. But Laura Charkoudian from Tacoma Park got us this bill in 2023, which says that when you file uninsurance for unemployment insurance, you are asked, are you now going to be uninsured in health? And if you are, the exchange will connect you to get healthcare coverage. I'm proud to say that over the last year, over 54,000 Marylanders have gotten healthcare coverage through that system. These are very important guardrails. So, Congress, let me just close by saying, thanks to the leadership of our exchange with Michelle Eberly, our health insurance coverage, and of course, our wonderful governor, Wes Moore, we are doing everything we can to protect Marylanders from negative stuff coming out of Washington. But we ask you to continue your great work in reducing that negative impact coming out of Washington so that all of us can continue the progress and going from 6% in Maryland to 0% uninsured, which will help all of us.
Vinny, thank you so much for those powerful remarks. You know, to listen to you makes me very proud of what Maryland has done. And all of our elected officials, like Delegates Charkoudian and Pena-Melnick and Madaleno, when he was a senator, the people who actually got policies for our state to try to get people health care, not to try to drive people off of health care, but to get people health care. That is the civilized approach to this. We all need healthcare. We recognize in our common humanity our vulnerability to sickness, to illness, to injury, to disability, and we want to make sure we're taking care of people. And it works when we do that. But now we've got a philosophy coming out of Congress and my colleagues across the aisle, which is to deprive as many people as possible of healthcare. It's just an extraordinary thing. Michelle was telling me that by pulling the plug on the ACA healthcare tax credits, everybody's premiums would be going up on average by 95% in the state of Maryland. But because the state has decided to act and to fill in for what the federal government has done, and as you just emphasized, Vinny, we're able to get that down to 33%. That's still very difficult for people, but if people's monthly insurance payments and payments for copays and deductibles were going to double, that would drive countless more people off of health insurance. So I'm proud that Maryland is doing whatever it can to try to pick up the slack in the face of these terrible cuts, but that's not happening in a lot of states. And this is why I come back to the point. I hope my Republican colleagues are spending this vacation period they have voted for themselves to go out and meet with people in their communities like you guys who are trying to address healthcare need. And they're going to hear what a disaster it is to let the tax credits expire and to drive all of these people off of Medicaid. And we haven't even mentioned the fact that meantime, RFK Jr. is also trying to pull the plug on lots of vaccination programs around the country. So this is a formula for disaster, what they're putting together. Thank you, Vinny. I'm now coming to my constituent, Rebecca Davis from Silver Spring. She's a fellow cancer survivor. She is an ACA tax credit participant and recipient. And she reached out to me recently, urging me to continue to fight to protect the monthly healthcare premium tax credits that have been so critical for so many people's care, including hers, and she's got a very interesting story to tell. So I wanted to make sure her voice was heard. So thank you, Rebecca, for joining us.
Thank you. Thank you, Representative Raskin. I'm so grateful for you to have put this event together and for all the work that you're doing. My name is Rebecca Davis, and as Representative Raskin said, I'm a Silver Spring resident. In 2022, I was diagnosed with a stage 3 breast cancer that doctors called a high-risk cancer because it's a high risk of recurrence. And at that time, I was on an employer-sponsored plan and had just incredible care. I was able to get chemotherapy and radiation. I enrolled in a clinical trial because this was a more aggressive form of cancer. And that was an immunotherapy trial. And it was just so reassuring to be able to get that care with the reassurance that I had good insurance. Unfortunately, the company I was working for, which was a healthcare startup, went out of business about 18 months ago. And I was initially on COBRA, so I went from having no premium on a monthly basis to having a $1,400 premium that I paid for several months, and kind of scrimped and saved and made it happen. And then in September of last year, I was alerted that that premium would go to $4,000 a month. So that was just more money than I was able to spend. And so I investigated other opportunities and worked with the navigator on the health exchange in Maryland and was able to move over to get coverage. And that has just been so helpful to me as I continue in recovery to try to do everything that I can to do what my doctors tell me that I need to do to avoid recurrence. And in my particular case, I was really fortunate in that a drug came onto the market that helps people like me who have a high risk of recurrence. And that drug is covered on the exchange. And so it was a very easy decision about which plan I was going to go on. And I just so appreciate the fact that Representative Raskin has continued to fight for the tax credits. If I did not actually have the exchange and if I didn't have this drug, I would be at a higher risk of recurrence. And also that drug would probably cost me on an uninsured basis about $12,000 a month. So I'm just extremely grateful for the work that everyone around this table is doing and know that we have someone who's working with all of his colleagues to kind of push in the right direction for people like me. Extremely grateful.
Well, thank you so much for coming, Rebecca. And I wonder to what extent people who've benefited from the Affordable Care Act monthly premium tax credits even know that's where it's coming from. In a lot of cases, they think it's coming from their state. But people are in for a rude awakening as these notices come out. We live in a state that has made a commitment to the healthcare of the people. And to be in Montgomery County is to be doubly fortunate to have the state commitment and the county commitment to deal with this. But there are millions of Americans across the country who are looking at some very stark choices as they get notices like this. This is one of the premium increase letters that went out to people in Montgomery County. The premiums are going to be going up. The monthly premiums in this person's case are going up, what's that, about 20%, like $140, $150. That's a huge hit for a lot of people. But for people who are going to just be thrown off, it's even much worse. And, you know, if you're waking up in Georgia, like in Marjorie Taylor Greene's district, and your premiums are going to double or triple, it's just incomprehensible how people are going to deal with them. All right. Now for our final participant today, I'm introducing my friend Ziza Ji, who is a constituent. He works for Seek, and he lives at the Main Street Apartments in Rockville, which is a wonderful facility. He is an actively engaged and contributing member of our community. I can't think of anybody who is more civically present and engaged than you, RZ. And he's agreed to share his story and why he's so interested in these Medicaid cuts. So I'm turning it over to you.
Well, thank you so much. Can anybody hear me?
Yeah.
Okay. All right. So, so good morning, everybody. Thank you, Congressman Raskin, for inviting me here. So, here's the statement. I will read. My name is Sija Z, and I live in Rockville, Maryland. I am a huge advocate for people with disabilities and Medicaid. Medicaid is the service I use for employment services through Seek, a community disability provider, and housing supports through Jubilee. I have two jobs, one as an IT user experience assistant here at Seek, where I serve 100 staff and the individuals we support. I also work at a giant courtesy clerk at a giant grocery store. I'm also a Protestant Church graduate, which is a one-year program that allows people with disabilities to have work experience through training. I like earning a living wage because it helps me to pay for things that are necessaries like food, utilities, and finding an apartment and other essential services that are needed for life. I have the housing supports through Jubilee, a community provider. I moved out of my parents' house last summer. I have two roommates, and I live at Main Street Apartment, which is affordable housing for people with disabilities, 25%, and neurotypical people, 75%. And it's also a community center, which provides activities for people with disabilities. Medicaid is needed for my services. If it's cut, it's going to be really bad for my services, and it's going to reduce the support I need for employment and housing. It will cost reducing the staffs of providers. I am independent, but I still need support through Medicaid. Thank you for allowing me to speak.
Thank you, Ziza, for your participation and for that important contribution to the conversation. I wanted to offer Rich Madalena an opportunity to give some closing thoughts, and I'll have a couple things to say, and then we'll open up to questions.
Thank you very much, Congressman Raskin. I leaned over and told him every time his phone went off, I was hoping it was Mike Johnson saying, "It's time to come to work." Exactly. The vacation is over. But no, I don't think that happened while you were here.
Not yet.
But I want to take a moment to thank all of the Montgomery County staff who helped pull this off. Mary Anderson, our Director of Public Information, Scott Peterson, Peter Sinclair, the team from HHS Facilities who made this happen, and of course, your office, who provide wonderful support for the constituents of District 18, sorry, that was a Freudian slip, District 8. So we have this wonderful board of information here too that shows the impact of just what will happen to people in District 8, which of course, all of these people are residents of Montgomery County. Montgomery County is larger than just District 8, but 48,000 people benefit from the enhanced tax credit in your district alone in Montgomery County. And again, who knows what happens to those people should they have to drop out of insurance. What happens to their lives, as Ms. Davis was talking about, as you heard the story of Mary from Dr. Peralta. And, you know, if this doesn't happen, it's the hidden healthcare tax that we are all going to pay. So don't think that somehow magically people will be healthy. They won't. People will die. The county executive says that all the time. People will die. Businesses will close because entrepreneurs have used this to start jobs, to start businesses. They will have to make those hard decisions. So thankfully, good people like you, I can't believe I'm going to say this sentence. Good people like you and Marjorie Taylor Greene are standing up. There we go. Are standing up to make sure that we continue with these credits. So
Yep.
Thank you very much, Congressman Raskin, for highlighting this issue and celebrating the amazing work of the Montgomery County government and the Montgomery County Department of Health and Human Services and the amazing people who work and devote their lives to the health and well-being of the people of Montgomery County.
Well, we salute you and everybody in the county level and everybody at the state level for what you're doing to get ready for these very scary changes that are going to come unless the Republicans come back and sit down and engage in the old-fashioned art of legislative compromise. I want to thank also members of my staff here with me today are Maria Ahmed, Ada Meja, Erica Fuentes, Abigail Ciparron, and Natalie Crute, as well as my chief of staff in the district office, Kathleen Connor. And I want to thank them for putting this remarkable assemblage together today and everything they do every day to serve our people who are trying to navigate the twists and turns of public policy during the Trump period. Let me just say finally, look, to lay my cards on the table, I'm a Medicare for All guy. I support national health care because I've been to countries, most advanced industrial countries in the world, most civilized countries in the world, just have health care for everybody. It's not put on small businesses to try to figure it out. It's not put on individual families to try to figure it out. You're just part of the system by virtue of being a citizen of the country. And I think that's where we need to go. But in the meantime, we at least have to protect and make work the programs we've got. That means Medicare, that means Medicaid, that means the Affordable Care Act at the federal level. But I've got colleagues who want to turn the clock back. And President Trump has been saying ever since he first entered the public stage, he was going to come up with something much better than Obamacare. It was going to be 1,000,000 times better than Obamacare, and it was going to cover everybody. I mean, obviously, he doesn't understand how our healthcare system has evolved or how it works. But now his administration is being run by people who have no problem dismantling health insurance coverage for millions of Americans. And it's an extremely dangerous thing, as we're hearing from people here in Montgomery County today. I'm glad that I represent a county that is so invested in the healthcare of the people, and we are going to try to absorb the shock of these terrible changes. It's going to be extremely difficult for us to do it, but it's going to be impossible for those states and counties that have not built up the kind of infrastructure that we've built up to try to protect the healthcare of the people. And so we're looking at, well, the kinds of things that have already, started in Texas, which is the spread of the measles. So you've got one part of the government under RFK Jr.'s expert control, which is pulling the plug on public health efforts on vaccination. And then you've got other parts of the government that are pulling the plug on people's ability to go see a doctor and to be treated. This is a recipe for disaster. We have got to reinvest in the whole public health infrastructure. I beseech my colleagues across the country, come back to work, come back to the Capitol. Let's negotiate. Let's restore the health care of the people. Let's reopen the government. Let's swear in my colleague, Adelita Grahova, who has constituents of her own she needs to take care of. And while we're at it, why don't we release the Epstein file, which the vast majority of the American people want. But at the very least, let's start by taking care of the health of our own people. With that, we're going to open it up for some questions to any media that are here, and please identify yourself, and the floor is open. Yes. Yes. Well,
That it won't go back down. Right? Subsidies go through, till the end of the year, beginning of next year, like people are lost.
yes. Well, that's a great question. But we know that they have unleashed chaos at the state level and in the county levels across the country. But what I'm hearing from people is that it will be much better late than never. In other words, we need to get those subsidies in, and we will scramble to get people signed up and covered. But I'd love to turn it over to, I don't know, Michelle, perhaps would you want to address that question?
I'd be happy to. And as you said, in Maryland, we will move mountains. We'll do whatever we have to give that extra tax credit to consumers so that they can afford their health coverage. And it's going to be confusing. It's going to be chaotic. We'll have to rely on all of our stakeholders in our community to make sure we're finding people to get them back if we've lost them. But we will do whatever we need to do to make it happen.
And that's Michelle Eberly, who's the executive director of the Maryland Health Benefit Exchange, if you don't know. And Congressman Raskin toured some of our offices upstairs, and I know the team here at HHS is ready to jump in at a moment's notice and start getting people signed up. When Congressman Raskin, Congresswoman Green succeed in getting the tax credits put through when the government reopens, we will be ready to help the residents of Montgomery County get all of the healthcare programs, insurance that they need.
So we would much rather get people signed up for health insurance coverage late than not at all. All right. Are there any other questions? Yes.
Congressman Max from Sunrise on the Hill, you have brought up that this issue is going hand in hand with the shutdown. How do you and your colleagues plan to tackle both if you can, knowing your limitations politically?
Well, I appreciate that question. It's unfortunate it has come to this, but on the Democratic side, we are absolutely committed to maintaining the health insurance coverage that we have in America. We don't want millions of people thrown off of their insurance plans because they can no longer afford their monthly premiums. And we don't want to throw millions of people off of Medicaid for the reasons that Ziza has pointed out. So we want to make that work. We also want to keep the government open. I represent more than 55,000 federal workers, but they have been very emphatic about saying that we have got to deal with these two problems at the same time. We need to grab the bull by the horns. We need to reopen the federal government on a basis that will allow people to continue to have their health care coverage. And while we're at it, I hope that we also will be able to negotiate a restoration of the jobs of all the people who've been illegally fired in the interim. Last week, more than 4,000 people were fired from 8 different federal agencies, including people at the Center for Disease Control, whose job it is to track the spread of different kinds of diseases in the country. So we want to reverse the entire war on the public health infrastructure. Any other questions? Because, okay. And people will be around. Presumably you can approach people individually if you want to have an interview. I want to, again, thank my wonderful staff and the Chief Administrative Officer, Mr. Madalino, the acting county executive today, and everybody from Montgomery County who came to join us, and all of my panelists, Dr. Ashford, Dr. Peralta, Vinny, DeMarco, Rebecca Davis, and Ziza G. Thank you all for coming today. Very grateful.
Thank you.